First tonight, a special report on the closure of the Barrett Centre, a mental health facility for some of the state's most seriously ill teenagers. When it was shut, the state government promised the best care would be available, and it says it delivered. But less than a year later, 3 former patients are dead. While 18-year-olds would normally be moved back into the community, the parents say that should have been with Barrett's ongoing support. The department admits it failed the 3, and documents obtained by this program show there was deep concern about the risks of closing the centre. Kathy McLeish reports.
These photographs were some of the last taken of Caitlin Wilkinson Whittaker. They're now part of an exhibition, but the peaceful, carefully arranged images give little sense of the turmoil she endured.
She started thinking of suicide when she was 13, and she had tried a few times, as had all the kids at Barrett. That's why they were at Barrett, because the community options were not sufficient to keep them alive.
But in January, the government closed Barrett, a mental health centre of last resort for some of the state's most vulnerable teenagers. Since then, Caitlin and 2 others have died.
I really send out my heartfelt condolences to the families for the devastation that they've experienced.
The government continues to back its choices.
The most important thing is appropriate models of care is to actually provide young people with their needs, mental health care needs, closer to their own community, and that's what we intend to do around Queensland.
But the parents say that's not the answer for everyone. And tonight, 7:30 Queensland reveals the expert opinions and the warnings in the lead up to the closure.
Yeah, she made this last Christmas and never got to wear it because she had to put a zipper in it and we just never got around to it.
Justine Wilkinson first shared her distress just a day after her daughter killed herself.
You know, she would have been pretty extraordinary if she'd grown up and been healthy. It's all right, people are put on the earth for a time and you enjoy them for when you have them.
Caitlin died in early August, about 7 months after the government shut down the Barrett Centre. She'd been out of the facility for more than a year.
It possibly might not have happened, or it might not have happened so quickly after she left Barrett, if there had been, as promised, adequate services for her and the other kids that were at Barrett.
Ms Wilkinson believes Barrett would have been Caitlin's lifeline. Like others in the centre, hers was a severe and complex illness.
So they went to Barrett. When they were a suicide threat, they were actually monitored 24 hours a day, always in contact with one staff member that was dedicated to them. So it was really intensive treatment. But the success stories that came out of Barrett because of this really intensive and holistic treatment were amazing.
Joe Oliver's son, Will Fowle, was the last to leave the centre.
They said they were going to do everything. There was going to be no rush. There was no way they were going to close the centre while the kids were being transitioned or while they were staying there until they found them, you know, places that did support their needs.
But she says by the deadline, at the end of January, the 18-year-old's only option was an adult facility next door.
So basically he went from his lovely support with the Barrett, with the teachers, the counsellors, the psychiatrists, the nursing staff, all the other kids, having a whole lot of activities and being engaged and everything, to him being with strangers in a unit. I just thought, my goodness, how is this going to go?
Some 5 months later, on the evening of the 10th of June, William Fowle walked away from the unit. Within an hour, he was dead.
Unfortunately, what he was intending to do to say, hey, someone help me, has basically ended in his death.
3 months earlier, Talia Nabau, the second last patient to leave Barrett, and another 18-year-old, had died. The coroner is now investigating all 3 deaths. But for some families and former patients, their worst fears about the department's decision to move away from long-term residential or Tier 3 care to a more community-based model had been confirmed. The government's own advice obtained by the ABC under right to information laws shows its own experts considered a Tier 3 facility like Barrett essential. Because there is a small group of young people whose needs cannot be safely and effectively met through alternate service types. And managing them in the community was associated with complexities of risk to self and others. One heading in the ECRG report simply states, interim service provision if BAC closes and Tier 3 is not available is associated with risk. The government says a range of appropriate care was in place and 2 Tier 3 beds were available.
We also had the capacity at the Mater for Tier 3 as specified by the expert reference group. And we've stood by that from the whole of the transition process. Those beds were available. They haven't been called on. Now, I don't know why they weren't called on, but
you've got 3 kids who have died and they weren't called on.
That's going to be an investigation for the coroner. The beds were available.
The closure was part of a bank of mental health reforms to provide new models of care, more community-based services and increase the number of beds available for adolescents. The Director of Mental Health in Queensland, Dr Bill Kingswell, says a plan to build a new centre at Redlands Hospital had been shelved because of delays and because of a new national direction in mental health services.
As that work emerged, it was clear that the model we were contemplating at Redlands wasn't supported by any contemporary thinking. What we were being driven to deliver was services close to people's home in their community and a range of options. So we were being told that we needed to deliver acute mental health outreach services for youth. They wanted day programs, they wanted a broader range of residential options in their community, and they wanted inpatient beds.
He says a new adult forensic unit on the Wacol precinct forced the deadline for the Barrett closure. This week, the government released the Director-General's report into the transition process, commissioned a week after the last death. It found that the closure date set an artificial administrative deadline and that the transitional planning occurred in an atmosphere of crisis with an escalation of distress in a number of adolescents. Even so, it found the individual transition plans were thorough and comprehensive, adequate to meet the need of patients and their families, and appropriate and took into consideration patient care, support, safety and service quality. But the authors didn't speak to the former patients or their parents.
The decision was taken that there was extensive documentation around the communication with parents and children that would be adequate. And when you look at the review team's findings, they're persuaded that they did have an adequate and complete picture of the governance and the transition process.
The families have been excluded, I think, from the whole process, right from the beginning of the transition period right through to this report. I have never seen a treatment plan for Caitlin. I've never seen a care plan for Caitlin that came out of the mental health system.
The Health Department says families were kept in the loop with regular consultation. It seems Queensland's Health Minister was also kept in the loop. Documents showed that as much as a year before the closure, he was receiving concerned letters. In November 2012, a psychiatrist from regional Queensland expressed deep concern, saying patients are only referred to Barrett when every other avenue of community treatment has been tried and exhausted. In May last year, an occupational therapist at the centre told him simply, "It keeps children alive." And in April, another member of staff argued there had never been any incidents from other adult forensic residents at the park, but they were acutely aware of the risk of death or severe injury to the adolescents by their own hand if they are not cared for in a unit like Barrett.
There is nothing to be celebrated about keeping a group of adolescents in a standalone psychiatric hospital for year on year. That cannot be a normalising experience for an adolescent. It is not a contemporary model of care, and it cannot be supported, particularly on a site where you have a forensic hospital, and we could be having a very different discussion today if anything had gone wrong.
One of Barrett's former patients says for some it's the only option.
When I was admitted to the Barrett Centre, I hated being there, I hated everybody there, I hated what they were doing. But looking back on it now, I can see that that was the key point, the pivotal moment that helped me turn my life around and ultimately get better and survive.
And some parents continue to believe the wrong decisions were made.
The Barrett Centre was there, so yeah, why close something that was working? Why do that?
And they were going back to substandard services that were insufficient and in some places non-existent.
What you're saying is that when these kids went back into the community, there was more there for them by January of this year than there had been before they went in. Better services, more services, closer to their community.
Well, my view would be more appropriate services closer to their homes and to their community. Better is not proven by the outcome.
The department says this is a high-risk group, and over the years of Barrett's operation, there have been other deaths among former patients.
This is a very complex group of people. You're absolutely right that they need a range of services that include extended treatment services. I accept that, but what I don't accept is that we don't have those services available. The 3 deaths is a terrible outcome that no one intended or would wish for. We tried to make a difference. We tried to get better care in place closer to people's homes. Those 3 children we've failed. The coroner will tell us in what ways we've failed.
And the Health Minister declined our request for interview.